A recording started now, Councillor.
Okay, thank you. Welcome to Ward End Ward Forum meeting. My name's Councillor Mohammed Aikhlaq, representing Ward End. This meeting will be recorded and live streamed, and it will be available to view as well. So I'll make a start. We've got, because due to the COVID situation, 3 weeks ago, the reason why I've held this special meeting was I noticed that Ward End was one of the top in Birmingham for cases per 100,000. And I've got the figures this week as well for last week, and we're about 5th in Birmingham. So we've invited Humera Sultan today to give us a briefing on COVID. So Humera, please, if you wouldn't mind.
Good evening, Councillor, and good evening to all the residents of Ward End. So my name is Humera Sultan. I'm a public health consultant working in Dr. Justin Barney's team. And yes, I'm going to be giving you a bit of a COVID-19 update and leave plenty of time for questions and answers as well, if that's helpful. So just in terms of where we're at in Birmingham as a whole, we are seeing our rate of COVID-19 decreasing in the city. So we're at about 215. I'll just bring up my, So we're just, the most recent data, which is kind of from the 6th to the 12th of February, we're at 215 cases per 100,000 across the whole of Birmingham. And if you look back to the week previously, which was the end of January to the 30th of January to the 5th of Feb, we were at just over 300. We have been seeing a continuous decrease week on week, which is positive, but we are higher than the rest of England, which is at about 130 cases per 100,000 at the moment. And actually, the West Midlands, we've got the highest 7-day case rate at the moment across the whole country. So we're number 16th in terms of highest in England in terms of our case rate at the moment. And when you look at kind of the reasons why people are getting COVID, one of the main reasons for that is around people mixing in households and other social interactions. So again, I can't really reiterate enough the importance of staying at home, unless you're in a support bubble or you've got a childcare bubble, then people should absolutely be staying in their own homes and not mixing with other people. When you look at other parts of the West Midlands, Walsall is higher than Birmingham in terms of its 7-day case rate, as is Sandwell. But all the other parts of the West Midlands are showing lower 7-day case rates. And when you also look at other core cities, so where we often compare ourselves to places like Manchester, Leeds, Liverpool, Newcastle, Sheffield, Nottingham and Bristol, the only place out of those cities with a rate higher than us is Nottingham. So as we've just said, we know that the rate of COVID-19 cases per 1,000 population in Ward End is relatively high compared to what we're seeing across the city. So the most recent data that we have around the rate of cases in Birmingham is at 1.93 COVID-19 cases per 1,000 population. But the rate in Ward End is at 3.16. So, and this is obviously why, we've called this COVID-19 meeting, and it's ranking at 4th out of 69 wards, so it's the 4th highest. Also, we've got 3 COVID-19 champions in the Ward End ward, and ideally we'd really like to push that number up. And I'll talk to you a little bit about how you could get involved in that if you're interested. Just in terms of other things to kind of make you aware of, I'm sure people will be aware that we have a vaccination programme now fully in place across the country. When you look at the most recent data, so there have been nearly 16.5 million first doses given across the United Kingdom, and also there's been just over 500,000 of second doses given as well. And again, we're not in a position to be able to offer the vaccination to everyone all at the same time. That very much depends on the supply of the vaccine. Compared to other countries around the world, we're doing really well in terms of getting our population vaccinated. But there is a prioritisation process, and there's an organisation called the Joint Committee on Vaccination and Immunisations. That's the JCVI, and they've come up with a prioritisation approach, really, which is, so the first set of people to be vaccinated as soon as the licences were made available for the vaccines for COVID-19 were those living in care homes and for older adults, and also their carers. Then it was offered to those who were 80 years and over, and also those working on the front line in terms of health and social care. Then it was offered to those over the age of 75, and then now currently it's being offered to those that are 70 years and over, and also those who are clinically extremely vulnerable, so those individuals who would have been shielding. And that's kind of where we're at the moment in terms of the vaccination process. So the next group of people to be vaccinated will be those who are 65 years old and over. Then it will move down to those who are aged between 16 and 64 but have got a long-term condition. And then it will be offered to those who are 60 years and over, then those who are 55 years and over, and then those who are 50 years and over. So we're approaching halfway around in terms of the prioritisation group. So we've done really well, but there still absolutely is, there is a way to go. And the message from us really, from public health, from all our council leaders, Councillor Ward as well himself has come out and said, anybody who is offered a vaccination and is eligible for and is being asked to come forward and get their vaccination, we absolutely urge that everyone does that. Currently, the approach for vaccination is to reduce the risk of death or being, seriously hospitalised because of COVID-19. That's why those priority groups have been offered the vaccine in that way, because the first priority group, those who are in a care home, we were seeing the highest death rate there. I know there have been some concerns about the vaccine, various myths circulating about, there's certain things in the vaccine that, will allow people to track us and so forth. None of that is true. Public health would not be asking our Birmingham population to get vaccinated if we didn't believe it was safe. Before I finish, I just wanted to make sure that everybody was aware of the COVID-19 vaccine. I'll put my teeth back in, of the COVID-19 Champions programme. So I'm just going to quickly do a screen share just to show you how, and I'll pop the information in the chat as well. It's just loading up my screen share, if you bear with me. So here it is. So before Christmas, we launched a COVID-19 Champions programme, where essentially we're asking local members of the community who live in Birmingham to come forward, get some training and help support sharing some really important messages about COVID-19 and how to keep people safe and to reduce the risk of passing it on. The message that has been going all the way through the pandemic about washing your hands, staying at home, keeping your distance, wearing a face covering when needed. So, if you're in an enclosed space like in a shop or on a bus or a train and you're around people you wouldn't normally be around, then absolutely asking you to wear face coverings. And to also really reinforce the messages about trying to about staying at home and not mixing with other households. We know that the rules have changed consistently throughout the pandemic, and that's caused a lot of confusion. And this is what COVID-19 champions are. As a public health team, we would give you the most up-to-date information to help you spread the right messages in your local community. So if you wanted to sign up, and having heard this, I'll put the actual link in the chat so you've got that. But you know, all the questions that you probably have around the Champions program is all answered here. And as I said previously, we've got 3 COVID-19 champions in Ward End, which is great. But ideally, we'd like some, you know, we would like more to be able to kind of help support the COVID-19 effort. I think, Councillor, I'll stop there if that's okay, and take any questions that people might have.
Okay, thanks for that, Amara. One of the questions is, because of the myths flying around social media and WhatsApp groups, and have we got any inkling on people who have refused to uptake, and what sort of figures are we looking at? Mainly, I'm looking at BAME community, and I'll be honest with you, I went for mine being vulnerable, and it was strange, where it was at the Cllr Road Washington Walking Centre, and looking around, you know, Alum Rock is predominantly BAME community, and I didn't see as many BAME waiting to have the COVID injection. So I was really disappointed. It's due to the myths. Have we got any figures on the uptake for the people who've actually been offered the vaccine but declined it?
We have got some figures, but they're not in the public domain, Councillor. But I think what you're seeing just in that experience of being in the GP or being in the walk-in centre and seeing who was kind of there waiting, that's probably quite an accurate reflection, I think, in terms of what we're seeing in the data as well. So it's just so disappointing that these myths have been kind of flying around, and obviously, you know, people are worried, and we have to take those concerns seriously, you know. But equally, this is where the COVID-19 champions would come in, is to really help really tackle those myths and help put people's mind at ease. It's fantastic that yourself, as a local member and leader in the community of Ward End, has had his vaccination, and you know, I think we need to get that message out far and wide. There are also some videos now that kind of healthcare professionals have produced in different languages that are also circulating, you know, around WhatsApp or on Facebook and so forth. So we can make sure that that Beverly gets the links to those to send them round to residents as well, if that's possible. Because again, you know, hearing a healthcare professional, you know, someone in a position of trust, speaking in your own language as well, hopefully will help people to understand why it's so important. I've done it myself. I've had the same conversation with my own family members. I've had to convince 2 of my aunties who are kind of in the risk groups to get the vaccination, and you know, it's almost like kind of tackling it one person by person almost.
Yeah, I've done that within family and friends, and as soon as people hear that, oh, I've had it,
exactly,
straight away they'll start booking. I was the first COVID champion for Ward End, by the way. We've got another 2. That's good to hear. But we must encourage more people to actually take up that role and try and encourage. There's some local radio stations who are encouraging people to actually come forward and actually take the vaccine. I think as soon as people start hearing that the side effects are very minor.
Absolutely, it's, you know,
I think that was the main worry of what side effects are we going to have. So I think people will start coming forward, hopefully in drones, as soon as they hear, you know, other family members they've had the vaccination, and And just going on to green spaces, since COVID, I mean, I had the long COVID, so I was actually in my bedroom for about 4 months.
No.
I caught it coming back on the plane on the 20th of March.
Last year, oh gosh.
Yeah.
Okay.
I didn't get out of the house until late July, and that was only for a walk in Warden Park. But one thing I have found, Hamera, is people are really, really using the green spaces.
Yes.
Warden Park is absolutely full. Doesn't matter what time of the day you go. You know, early mornings, you know, is probably the busiest. But even throughout during the day, even when it was snowing, people were, you know, actually out there. They've got to get their walks in. So it's really, really good to actually see that people are getting very active. You know, for other health reasons as well. I mean, there's a lot of diabetes in the community, and I've had it for about 19 years, and it's really good to actually see them using the green spaces. You know, the families coming out, and because of the lockdown and now half term, you see a lot of children, you know, young children, families and it's good to see that they staying in their bubbles and their groups and not really mixing. It's only the households that are there, so that's really, really good to see. And you'll see that majority of the people, even though they're in open spaces, they're in the park, majority of the people still, you know, wearing the mask and keeping their distances. So that's really, really good to see. Because first, the myths that were out right at the start were there isn't COVID, there's no such thing, it's just, you know, just a flu. And I think people have realized that, you know, it's out there and it's very, very dangerous, and we've got to be really, really careful. But we've just got to concentrate on getting people vaccinated more and more. The more people get vaccinated, the safer it is for all of us.
Absolutely, I couldn't agree more. You know what? We could be swapping seats, Councillor, almost, and have you deliver this presentation. But everything you say is right, and we will be in lockdown for longer. The lower the uptake of the vaccination is, because the whole point of the vaccination is to protect the most vulnerable, and the whole point of lockdown is to protect the most vulnerable. So if we can find another way to protect them through vaccination, then that will allow us to get out of lockdown sooner. I know people are struggling now immensely with, you know, it's been nearly a year now since the lockdown started. People are missing their family, are missing just, you know, doing things that they used to do, and children want to be back at school, parents want their kids back at school. And we know it's going to have an impact, you know, long term. So the sooner we can, you know, the more quickly we can get the population vaccinated, the sooner we can actually start to get back to some sort of normality. Yeah.
One of the things, Amanda, one of the things that's always bothers me now that they're looking at, you know, from next Monday is easing the lockdown. My biggest worry is the first thing I think the government are going to start easing on is schools. If that was the case, the vaccination program should have targeted the key workers, and I mean the school staff, the teachers, the dinner ladies. That would have been a really, really positive. I think parents and people would have been more comfortable sending their children to school once if they knew that the vaccination program, you know, the teachers they've had the vaccination. I think it would have been easier for them to actually send to school. I know the attendance is really, really good, even online, and some of the academies. I've been involved with schools for 26 years as a governor, as a board director, and as a chair, and I know what it's like, even for parents, and I deal with them. And I really, really think we should have targeted the key workers. They're the ones who actually look after, even hospitals and teachers. And I think we should have targeted them. They should have been in one of the top groups of 4 out of 9.
So we've had this conversation. I've had this conversation quite a lot with teachers, because my actual my role in COVID-19 is to work with our schools and early year settings and so forth. So, and we've gone over this. Actually, we've gone over this quite a few times, and I completely understand why teachers feel that way as well. But I think the issue with it has been, because the amount of vaccine that we've had has been limited in terms of its supply, the priority has been to those at most risk of death. And actually, when you look at the data, this isn't going to give any consolation to those teachers who have been really, really ill with COVID. But when you look at the data as with the country as a whole, teachers actually, they're not any different to the general population in terms of their outcomes from COVID, which probably feels quite surprising. And also, the evidence is still coming through about how good the vaccination stops you passing it on to somebody else. So normally with vaccination, the whole point of it is that it stops you becoming seriously ill, and also it stops transmission in the population. But you normally need to have quite a high level of the population vaccinated to be able to stop that transmission. So there's no guarantee, even if staff were vaccinated, that actually they wouldn't be passing it on to the children in the school. But I completely hear also what teachers are saying, that they're there on the front line as well, teaching day in, day out, and putting themselves at risk as well. So it's not an easy situation. And I think if we had an unlimited supply of vaccine, it wouldn't even have been a question, really. So
what's the next target, Hamera? Specifically, I know, almost 16 million have been vaccinated, and most of the over 80s, and more specifically, our ward or our in Birmingham, what sort of figures have we got? Breakdown of per constituency or per ward on the take up and number of people that have been vaccinated? Because it'll give you a bit more idea on the numbers, because I was worried about obviously Ward End being 3 weeks ago one of the highest in Birmingham, and even now 4th. It's worrying, but I wondered if it got anything to do with the vaccination process. So have we got breakdown of people vaccinated, how many, and from which communities? Anything, any data like that? I know you probably can't share all of it, but just an inkling of maybe encouraging people to take up the vaccine.
So it's taken quite a long time for us to start getting the data, because actually it's the NHS that is managing all the vaccination process right now. So normally, so vaccination is an absolutely key public health intervention. Before the public health were in the NHS, part of primary care trusts and so forth, then we would have been in part of that team completely. So it's taken us quite a long time to get access to the data, and it's now started to come through. But you've rightly said, the data that we've got at the moment, we're not in a position to share that, but I know we are looking at finding a way to make it more accessible, because I think it is important, that people understand what vaccination is like in their local community, because actually, when you're also getting vaccinated, you're not just doing it to protect yourself as well. You're doing it also because you're going to be trying to reduce the spread in the population. So absolutely, at the moment, it is about trying to protect people from dying from COVID as much as possible. But the more and more people that do get vaccinated, the more kind of protection there will be in the community. So that's something that I absolutely will take back to the public health team to find out exactly when it would be possible to start sharing this kind of data.
We've lost a lot of pillars in the community due to COVID, and it's really upsetting. Some of the people who actually established, and they are probably one reason why we are here in the positions we are here, and it's really sad. I don't think there's anybody who doesn't know anybody or friends or relatives who haven't lost a loved one. So it's really upsetting to actually see that. But what about different variants, Samira? Because when it first started, when I caught COVID, but when I was in the house, okay, I kept. We got somebody. When I actually got when I caught it, my family was fine. But I'm finding now locally, especially in Warden and in Birmingham, once I don't know whether it's a different variant or the whole families are testing positive. Is that because of a different variant or?
So we've got the Kent variant circulating now, which kind of appeared around kind of Christmas time, and then more recently we've got the South African variant now, which has been picked up in the Frankley Great Park ward. But what we do know about these variants is they are more contagious, so they're able to move from one person to another more easily. So absolutely, what you're describing about seeing kind of whole families affected. That is very possibly down to it maybe being a variant rather than anything else. Also, it really does depend on kind of, the advice is if you do get COVID is to try and isolate yourself in your house as much as possible away from the rest of the family. But, we know that people in reality don't live their lives like that. Most families have got one bathroom to share, and it's if you've got young kids, they're coming in and out of your room and so forth. So it is as much as we say, have different towels and your own utensils and have food in your room and so forth. It's really difficult to do that. So, but I'm not surprised by what you're saying, given what we do know about the variants that are circulating at the moment. So.
Okay, we've got Abdul Ali in the meeting with us, who's just joined us. Abdul, do you want a quick catch up or brief of the meeting, or are you okay? All we've been discussing is COVID and how it's impacting our communities and why the rates are higher, and the reason why we held this meeting is to try and encourage people to take the vaccination and basically have more COVID champions for Warden, because we've actually only got 3. If you don't want to speak, you can actually write in the comment box if you like. Okay, Amanda, do you want to carry on green spaces? I think we've covered just over half an hour on.
Yeah, thank you, Councillor. So just to say, green spaces are, for me, they're one of the antidotes to COVID-19. It's one of the few things that we have at the moment that we can actually do by ourselves, with our family, or our household people that we live with. And Birmingham is blessed in that it has 591 parks and public and green open spaces in the city. And I've been to Ward End Park quite a few times actually, and I'm so impressed by what that space has to offer. I remember my husband actually needed to go into hospital at Heartlands for a checkup, so I had to drive him. So while he was getting checked out, my little boy Issa and I just spent a couple of hours at Ward End Park, and it was just such a lovely morning. And we need to encourage our communities to be using these as much as possible. And it was so great to hear your own, kind of personal reflection that the park has been more used than ever before. That's the same with my local park as well. I've seen the demographics actually change over the last kind of 6 months. I mean, I used to use the park quite a lot to go running, or for walks, or take my Issa cycling. But now, and now it's so full, and people of all colours, ages, sizes and shapes are coming. Seeing people running, walking, cycling, all having a go at doing some physical activity. It's no longer a thing that you do if you're really active and really fit. And that for me has been really positive. So what that we're doing in Ward End is we're trying to encourage as many people to volunteer as possible. We have a new recruit called Freddie who is doing the rounds of Ward End Park. He's there. Oh, I think Issa's come to say hello, councillor. Hello.
Hello, Issa.
He's been making a bird box with his dad actually, so because it is National Bird Nesting Week, so there's a plug. And Freddie's job is to really help support local people to get more involved in volunteering. And what we're trying to do also is break down the stereotype of who gets involved in green spaces. When I tell people my job, even my own family can't understand what I do. I mean, I'm British, Muslim, Pakistani, and no one in my family has ever had a job like this working in green spaces. And when you look at the park service, hardly anybody looks like me. But a lot of Birmingham looks like me, so we need to see more of that in our park service and in our volunteers, because our green spaces are there to serve everyone, not just a few. So, what we can do, councillor, is maybe through Beverly and with your, through your distribution list of who you have on the Ward End Ward forums, we can send people out all the information about who to contact and how to get involved in various activities. It has been challenging with COVID-19. We've not been able to do as much stuff in the park as we would have liked to have done. But we'll wait and see when restrictions lift. We're starting to do things virtually. We've put together, so Ward End Park is the home of our employment pilot. It's looking at how do we get as much green space skills into Ward End. So we've actually got a YouTube skills showcase that shows people different kinds of jobs you could get involved in green spaces. I think most people think, you could become a gardener, which is absolutely, it's a great job, a very important job, but there's hundreds more that you could get involved in as well. I could keep talking about this forever, but it's we'll absolutely make sure that Beverly has key contact details of the people involved in Ward End, so that anybody who wants to reach out can.
Just before I bring in Abdul, who's raised his hand, Ward End Park in the last 12 months, we've had a new football pitch, which is absolutely fantastic, well used. All the cricket nets have been renovated and put to good use, and I see people every day, even in this weather, practicing their cricket skills, and also the next project, which Mike Hinton is helping me with, is volleyball courts, because there's hundreds and hundreds of people playing volleyball. So where the old bowling green was, we hopefully going to be installing 2 volleyball courts actually there in the not distant future. So that will encourage more youngsters to actually come and use the parks, and obviously the project with the White House and the Dolphin Centre. I mean, Maxine's doing an absolutely fantastic job there, for the ladies. So hopefully there's good things planned for Ward End Park. So Abdul. can I just bring you in?
Thank you, Councillor. Yes, I'm actually concerned about one scratch on the grass that happened in the park, and wonder about any activity I can actually support the White House in the park, any development to come, or any support. I wonder just about it. Love to speak to councillor or to anyone related to the park about any business I can do more with the park, in particular with the White House.
Okay, there's plans for the White House, Abdul. We had Civico in to give us some quotes. The first thing we need to do with the White House is grade 2 listed building, so there isn't much we can do outside, but inside it does need a lot of work doing, which Civico will probably undertake depending on the quotes. But Humera, there's a organization, I don't know you heard of them, Saheli?
No.
Right.
I'm glad I had attended a course in the White House before, and it was a nice course.
That's Abdul. That's the idea. Once it's been done, is hopefully it'll become a training center for people like the Heartlands Hospital and HS2 coming aboard. So hopefully a lot of people will start using the White House once we've got it all renovated and ready as a training center. But Amira Saheli, they sent me Nasreen or Naseem. She sent me an email. They want to do. I know they've been doing the cycling project for quite a number of years, which people have really enjoyed, and they've learned, and they do ladies' classes separately. But I'm sure they've got something else planned. Week tomorrow, I've got another meeting with them to actually discuss what they've got planned. So really, really good news for Ward End.
Thank you, Councillor.
Okay, Abdul. Abdul, is there anything else you wanted to mention, reference Ward End, any other business, or
No, just I love to actually see more discussion and more businesses and more actually views, any development to serve the local society in the Wishwood Hills Park, from actually the lake, from the playground, and from also the grass, and from the place for the children entertainment I've seen there. And I'm glad really I attended educational course quite a while ago in the White House. And I see from my actually point of view, there is more business to be attached to the White House to serve the society need, in fact, which I see there is some needs, the society now. This White House, in fact, has to involve in the heart of the society and respond to what they need. And they need the elder to come forward to speak what they need, about what they need.
Okay, thanks, Abdul. There are really, really good plans for the White House and for Ward End Park, and hopefully you will start seeing the difference.
Thank you.
Okay. Humera, anything else you want to touch on?
We are actually looking at sponsorship kind of deals as well in our parks and open spaces. So we've, as a council, we have a corporate sponsorship contract, which kind of, mainly around advertising and things on billboards, especially on kind of, in council spaces. But we're looking at actually, would local or bigger corporations or bigger businesses want to put some money into our parks in terms of helping to support some more activity? So I think Abdul mentioned the actual lake and so forth, but could we actually use that more for, actually recreation maybe and so forth? Of course, that needs to be paid for, but sponsorship could absolutely do that. So we've just started that kind of conversation and that journey. And Warden Park, because it's part of the Future Parks work, is on the list of parks to potentially, you know, receive that. So we'll have to see what the kind of take up is from local businesses. But more and more we are seeing local businesses wanting to do things as part of their corporate social responsibility. I can give you an example. We're testing out some fundraising in another park, which is part of our. I'll do jigsaw in 1 minute, okay? 1 minute. Sorry, councillor. I'm coming. Okay. Okay. And you know it's. Okay, just 1 minute. And we're doing some local fundraising for Dorbury Fields, which is in the south of Birmingham, and we've. Isa, John, just Tero, Isa. I'm coming, maybe after you, John, okay? Maybe after you. I thought I was doing quite well for 40 minutes without being interrupted.
Mum, you talk so much.
I do talk very much, yes.
Mum, you talk too much.
Do you want to see my friends?
No.
No?
You talk too much.
Okay, I'm gonna just say this and I'm gonna come, okay? And we've actually done a crowdfunding site there. Okay. I'm so sorry, councillor. Isa, maybe be after you, John. Okay, I'll be 1 minute. Okay. And we didn't know if it was going to work. You know, asking local people would they be willing to kind of put some money in to support the park. And we actually put we want to create a habitat for a very specific kind of species there. They're called slow worms. They're actually legless lizards. And we wanted to raise £2,000, and actually after 3 weeks we've hit £1,000 already. And a local business has come forward to say that actually as part of their CSR, corporate social responsibility, they want to provide all the labour free of charge to actually help build the habitat. So actually that £2,000 is going to go way further than we actually thought it would. So all these things are starting to come together, and we're trying to find the best way of doing them. And once we've got that, you know, we can start testing it out in other places. We know that not everybody can afford to support our local parks, but what's interesting is we've had people nationally supporting this campaign because, you know, kind of reptiles are really close to their heart. So, and I'm sure if Ward End wanted to do something like that, we could support you in doing that as well. So
there's a lot of businesses out there, Humera, because we had the flower beds. I think it was last year, the year before. They were damaged, vandalized, and one of the things we've got to seriously start looking at is I know there's a lot of positives, and I've mentioned this in the Friends of Warden Park meeting just before, prior to this meeting, is there are some negative people. So we've got to look at protecting our heritage and our facilities, and so, you know, I think CCTV cameras will come in really handy. And since the pandemic, fly tipping's gone out the roof across Birmingham, not just Warden. I mean, me alone, last year in 12 months, we reported 734 fly tippings. 700, and that wasn't just 734, because sometimes I put in one email maybe 2 or 3 fly tipping, you know, on my walks. So, you know, you're looking at excess of 1,000 fly tipping. So we've got to protect our park.
absolutely.
I think so. You know, when we start looking at improving and developing, you know, open and green spaces, we've got to find a way of protecting them. And if it means, you know, spending that bit extra just to protect, I think we really need to have a look at that. So, yeah.
Thank you. Yeah, definitely something for us. Yeah, absolutely. Completely agree.
And I was talking about the flower beds that were damaged, and we approached HS2, and they said, look, you know, we can't at the moment financially, but we got loads of workforce who could come and help out. So it was absolutely fantastic. You know, they came and done the flower beds for us. So there is opportunities out there, and there is opportunities for sponsorship. You know, in you know, if you're going to do projects that's going to help the community.
Yeah, absolutely. And that's the kind of stuff that we're talking about in terms of people using their their corporate social responsibility to kind of help. It's not always money that you need, it's actually time and energy from, you know, enthusiastic people. So that's great that that connection was made.
Okay. I think Issa probably needs you more than I do now, so well, I'll let you get on, and I'll have a chat with Beth. Thank you very much for joining. Thanks.
Oh, you're very welcome. Yeah, no, thanks for the warm welcome, Councillor. Yeah.
No problem. Wish you all the well.
Have a good evening, everyone.
Thank you.
Okay, take
Thank
care.
you.
Bye-bye.
Thank you. Bye-bye. Bye-bye. Hi, Bev.
Yeah, hi, Ed. So, is there anything else, or do you want to bring the meeting to a close now, Councillor?
Unless Abdul's got under any other business, if he wants to bring anything up. Not a very good turnout tonight, but nevertheless, you know, we've had the briefing, and it's going to be there for people to see. You know, if they couldn't attend the meeting, they could quite easily go onto the website and listen to the meeting. Hopefully, and give them some encouragement in coming forward, and hopefully to stay safe, which is the most important. That was the idea of meeting. Let's get these case rates for COVID down for Ward End, and encourage any other people who wish to volunteer to be COVID champions for Ward End. And thanks to Pat and yourself, Bev, for organising this.
Okay, yeah, that's okay, Councillor. So thank you. So I'll bring the meeting. We'll bring it to a close now, and I'll just stop the recording. Okay.
Okay.
Okay, great. So I should do that now. Thank you. Thank you, Abdul, for joining us. Thank you.
Thanks, Abdul.
Fantastic.
Thanks, Abdul.
Yeah. Take care now. Bye.
Thank you.
Bye.